most of these patients will have some eating disorders, will have psychiatric disorders, will have eating problems, may have depression, will have joint pains. They're not eager to do exercise. They have some health issues in terms of diabetes. So you need to understand the whole gamut of problems of these patients, number one. Number two, it is important to understand that these patients require very tender care, right? These patients are also, not all, but social outcasts, right? These patients have not been, they've been taken for granted sometimes, not been given their dues. So उनको बहुत tenderly देखना होता है. Thirdly, these patients don't want to be seen in public sometimes. So your OPD should be slightly secluded. You want to give them that time.
Correct.
Fourthly, the place that you see. Now, for example, if I have an OPD which has a very narrow gate and a small seat, someone walking in will not feel comfortable. उसको लगेगा मेरे जैसे तो patient ही नहीं आते यहाँ पर, right? So you must take care of their needs, and not because you want them to operate, but because you should be passionate about your work. You should be caring enough for them that when they walk in, your door must be wide. Your seating should be wide. It should be good enough for them to be seated.
Correct.
Right? So these are very small little things that the patient understands and sees that they understand. Then once they get admitted in the hospital, for example, right? Like for example, right now we've got a lady who's about, I think, 220 to 30 kgs, right? If we don't even have clothes to fit her, how does she feel?
Exactly.
She feels cheated, right?
Yes.
So they should know that we care for them.
Correct.